Do you have digestive issues? Perhaps you're bloated all the time, especially women. I get a lot of patients, female patients, that complain of bloating, distension, no matter what. Empty stomach, full stomach, little bit of food, and it's very frustrating because it seems like no matter how strict your diet is, you take all your digestive enzymes, you try to eat perfect, more perfect than your friends and coworkers are, and they aren't bloated, but you're constantly bloated, and you feel like you can't have a social life because you're experiencing this chronic inflammation in your gut. And so I get a lot of those patients very frustrated, especially females, because we're very sensitive around that area. And what I want to talk about is getting to the underlying cause of these stubborn digestive issues. The bloating, the feeling full after a little bit of food, constipation is a big one. Maybe you're trying to do a weight loss program, but you're dealing with chronic constipation. And then with that, you're just going to get more toxic. Perhaps it's the other way. Perhaps it's diarrhea. You get malabsorption with diarrhea. You can't get your nutrients into your body when it's constantly going through your digestive system. So that's what I want to talk to you about, is we can talk about lifestyle, but most people know, hey, stay away from the gluten, stay away from the dairy, eat a really clean lifestyle. But wouldn't you like going to be able to go out with your friends once in a while and eat like a normal person and not have to suffer the whole next day? And that's what I want to get to, is why is the body so inflammatory? Why is one little thing, you get off your clean path of eating just by one meal, and it takes hours or even a couple days to get the digestive system back on track? And we want to get to the underlying cause, and how I do that in my practice. I do phone consultations, Skype, video sharing, and locally in my office to treat digestive disorders is DNA testing. So along with the lifestyle counseling, I do DNA testing to find out what the underlying cause of the digestive inflammation that you're experiencing, to find out how we can treat that. Because when we don't know what's going on, we don't know how to treat it. A couple chemicals are produced by your body that are byproducts of your metabolism. There's a couple of them that disrupt the intestinal lining that contribute to leaky gut, if you've heard of leaky gut. The first chemical is peroxynitrite, and that's produced as a result of a certain metabolic pathway that's going on in your body day in and day out. And we don't want a lot of this chemical in our body. It especially affects the digestive system. Some other symptoms people will feel is like aches and pains from having too much of that chemical. And you get the leaky gut, possibly, most likely. And with that, fatigue is a big symptom of leaky gut. You're not going to be absorbing your nutrients when you have leaky gut. So chronic fatigue goes hand in hand with digestive issues. And so we want to treat the underlying cause by scavenging that chemical out. And there is actually a product, a supplement that I work with my patients called peroxynitrite scavenger. So we do the DNA testing. I use the 23andMe lab. And in that report, a lot of people have already done this test. It's been very popular, very useful. And they're giving out more and more health information. There's still a big report in there that needs to be interpreted by a software program. The FDA still is not approved for that to be interpreted by the lab. That needs to be interpreted by a physician or an alternative practitioner, and that's the report I work with. That has the wealth of health information of what's going on inside your body, whether it be detox pathways, metabolic byproducts of neurotransmitters that might be contributing to anxiety, depression, or insomnia. Lots of digestive information is in there. That peroxynitrite, there's a second chemical that causes gut inflammation, and that's histamine. And guess what? There's a supplement you can take, histamine scavenger, if you're not good at scavenging out the histamine. So you can maybe have that glass of red wine. So there is the perspective of, oh, okay, I'll just stay away from everything that gets my gut inflamed. Or how about getting the body towards a little bit more tolerant? So we all want to live a healthy lifestyle because you're generally going to feel better, you're going to live longer, you're going to prevent some more serious diagnoses in the future, but you also want to have a life. And so if genetically we can get ourselves to be stronger and more resistant, wouldn't that be great? And so there are some supplements that treat the genetic variations that we find in the 23andMe DNA test, such as these inflammatory chemicals that disrupt your gut. And if your gut isn't working, if you're not digesting your food and it's moving slowly, especially for women, that it interferes with our lifestyle quite a bit. So if you haven't gone to the 23andMe website, it's just 23andme.com. It's really easy to get your own test. If you already have your results back in, definitely message me through my website or contact me for a 10-minute consultation, and I'll direct you to how to get a hold of that DNA file. It's a raw data file. So I just need to guide you within your results of your 23andMe DNA test and get that downloaded, get that over to me, and then we can have a consult over the results of that test and find out what chemicals might be too high in your body that's causing the gut inflammation. Okay, so definitely message me through my website if you have any questions about the 23andMe or the report.